Peyronie's disease is an abnormal curvature of the penis, generally seen on erection. You can also sometimes feel the abnormality of a Peyronie's plaque, which is scar tissue on a flaccid penis. Peyronie's disease is caused by abnormal healing of the tissue of the penis after trauma or injury. For some patients, they remember an incident where they did have a traumatic injury to the penis. For some patients, they don't remember a particular incident. And so we think that Peyronie's in that scenario may be from just repetitive injury, minor injuries over time during sexual intercourse. Peyronie's disease can shorten the penis and shorten the length of your erections. It can also decrease the blood flow going into the penis, so actually decreasing the firmness of your erections as well, causing erectile dysfunction. And of course, it can also cause bending of the penis. So if you have a severe curvature or bend of the penis, you may not be able to have vaginal penetration or sexual intercourse. Peyronie's disease is diagnosed both by history and by physical exam. And so my patients, if they have had curvature or bending of the penis, they'll report the severity of that. And then on physical exam, I may be able to palpate or feel the Peyronie's plaque or the area of scar tissue inside the penis. I also do a physical exam when the patient has an erection to visualize the degree of the curvature and also do an ultrasound to look for any areas of calcification and determine the blood flow going to the penis. So unfortunately, with Peyronie's disease, it's generally very difficult to go back to the way that you used to be or have it completely return to normal. But the good news is that there are things that we can do to help straighten the penis and make it functional again. And the first thing that I have patients do is start with stretching exercises. And so I have patients go online and buy what's called a penile traction device. And when they did clinical trials on this, patients who used it for several hours a day over the course of a few months saw better results and actually significant improvement in their curvature. So this is definitely something that you can start doing at home right away when you have Peyronie's disease. It's just like any other physical therapy. The more consistent and regular you are about it, the more effective it's going to be. Now, as far as medical treatments available, the first one that I offer patients is an injection called Xiaflex or collagenase. And this is an injection that's done in the clinic by myself or another urologist. And this is done directly into the Peyronie's plaque or the area of scar tissue inside the penis. And that medication actually works to break down the scar tissue. More invasive treatments are surgical options, and there's two main surgeries that I offer for this. The first one is called penile plication. This is where I place stitches on the opposite side of the curvature in order to straighten the penis back towards straight again. We can see at the time of the surgery that this has been effective, and so the advantage of this over the injection is that it is a much quicker procedure and works right away, and the recovery is quicker. For patients who have a mild to moderate curvature up to 60 to 70 degrees, this can be very effective. And so I have had very good results from this with many patients. For patients who have more severe curvature than that, or who have complex Peyronie's with multiple curvatures, then they might need the more invasive surgery, which is an excision or incision and grafting. So in this procedure, we actually go in and either open up the area of scar tissue or excise it or remove it completely, and then cover that area with a graft. Now this is a little bit more invasive of a procedure and has more risks involved, including a change or loss of sensation in the penis, whether that's the shaft of the penis or the head of the penis. There can also be a worsening of erectile function, either requiring oral medication or injections or even surgery with a penile implant to correct for that. So like I said, there are many different treatment options available, and depending on your assessment and how severe the curvature and the complexity of the curvature will determine together what the appropriate course of action is. So the treatment that's right for you is dependent on several different factors. One is the severity of your disease, and so the severity of the curvature, what degree of curvature you have, and also just what level of comfort you have with the risks of each treatment or surgery option. When a patient's Peyronie's disease is in the stable phase or chronic phase, then about 60% of those patients, the curvature remains about the same. About 20% get a little bit better on their own, and 20% get a little bit worse. And so over time, you can have worsening erectile function with Peyronie's disease because of the restriction in the blood flow into the penis from the scar tissue.